What if I tell you that your elevated blood pressure will normalize to a normal range if you practice guided breathing or paced breathing, about 6 to 10 times per minute? What if I tell you that it is not salt that causes increased blood pressure most prevalently, but it is stress, which cascades to increased cortisol and increased sugar. So sugar also contributes most. What if I tell you that the vagus nerve, if you tone it by guided breathing and paced breathing, if you do it regularly, will maintain your blood pressure in normal range? If you like this topic, please click the like button, and now we can start. Let's start with the definition of high blood pressure or hypertension. Hypertension was labeled kind of leniently, but now we have found out that the chronic elevation of blood pressure has an effect on the end organ damage, which is basically the arteries of your circulatory system or atherosclerosis, and that can also affect the kidney, can produce chronic kidney disease. The normal blood pressure range is now defined as systolic blood pressure. It's a number above less than 120, and the number below, which is the diastolic, less than 80. Stage 1 hypertension is now defined as 130 to 139 over 80 to 89, the diastolic pressure. Stage 2 hypertension is 140 or higher with a diastolic blood pressure of 90 or higher. Any blood pressure more than 180 systolic and a lower number, the diastolic, more than 120 is called hypertensive crisis. It is an urgency. You need to go to the urgent care or emergency room or call the doctor, because this has an acute effect. So you need to act right away. Turns out that it is stress or the sympathetic overtone, the fight flight, the amygdala, which is the center in the brain for anxiety, anger, and depression. Sympathetic nervous system is triggered by the fight flight, or results in the fight flight reaction with all the impulses that goes to the ear, to the eyes, that triggers the sympathetic tone and cause you to be hyperactive, gives the amygdala the chance to be so hyperactive. You need to switch it to parasympathetic tone by guided breathing meditation. Very powerful. In fact, my patient, a couple of them already, have successfully maintained the blood pressure, and these are the patients with elevated blood pressure and stage 3 high blood pressure, not the hypertensive crisis. You cannot fix that right away with guided breathing. The parasympathetic tone is rest and digest. That calms everything, the microbiota, the brain, and that is what you need to maintain. Back to these two patients. One patient who is about 70-year-old, he was so consumed by listening to news cycle. Specifically, he was listening to the current events, especially the violence somewhere there in another state. This caused him not to sleep. In fact, it triggered also his blood pressure to be elevated. His blood pressure when he came in for evaluation was 160 over 100. So he satisfies the stage 3 hypertension. So in front of him, I asked him to breathe deep, slow. So we aim for 20 repetitions. So essentially I guided him with breathing 4 counts, inhale, 1, 2, 3, 4, held, 2, 3, 4, exhale, 2, 3, 4, 6, hold, 2, 3, 4. After the 5th repetition, his blood pressure in his eyes, in front of him, dropped down to 140 over 90 from 160 over 100. So dramatic. So he was inspired. We continued on until the 10th and then the 20th. By the 10th cycle, his blood pressure went down to 130 over 90. On the 20th repetition, at the end of our session for the breathing, it went down to 110 over 80. So that's beautiful. So he went home, had a follow-up for a week. After a week, his blood pressure maintained in such a level about below 110 over 80. What does it tell you? The power of sympathetic overtone can trigger from the bad news that he was receiving all the time. Most important thing also, he resolved that not to watch the television and only watch a glance, maybe once a day, but not the whole day. This made him so happy, very inspired, that his blood pressure normalized. Another case was another professor who did the same. if in front of him, his blood pressure went down from 160/110 and brought it down to 120/80 at the end of the 20th session. Is there a scientific basis for this? Yes, there is. There are 3 papers that I'm going to share with you. This is the paper first about the slow-paced breathing and autonomic function. Autonomic function is referring to the autonomic nervous system, and the same effects in this study showed that stage 3 hypertension or blood pressure less than 160/100 can be treated with guided breathing. Another paper that I'm going to share with you is this paper, Effects of Mental Relaxation and Slow Breathing in Essential Hypertension. This was written by Kaushik et al. And cited and reported that a slow breathing for 10 minutes each day, separated by a quiet period of 15 minutes, effected decrease in the blood pressure by 10 points. In another study, which is Breathing Exercise for Hypertensive Patients, a scoping review, they reviewed 339 articles in total from 3 databases, and they said the blood pressure corresponded between 18 to 75 years old. The systolic blood pressure declined by 4 to 54 millimeters mercury. How powerful is that? There are 3 important mechanisms of essential hypertension. Number 1 is a sympathetic overtone that comes with anxiety, depression, anger. And this stimulates the cortisol, the stress hormone that increases blood sugar, figuring out, again in a loop cycle, triggering the sympathetic tone. On another circuit, it stimulates the adrenal axis, or the adrenal gland, to produce norepinephrine and epinephrine. The norepinephrine is a powerful substance that constricts the blood vessel, thereby increasing the blood pressure. Other mechanisms that are involved also is the derangement of the reflex in the carotid sinus and the aortic arch. Breathing enhances the reflex sensitivity such that when you do the guided breathing, your blood pressure goes down. Another cause of blood pressure, which is rare, is the production of norepinephrine and epinephrine from adrenal tumors or other tumors that produces these substances. But this is rare. We're focusing on the essential hypertension or hypertension that is not caused by any organ damage or organ tumors. So what is the remedy? Simple, paced breathing or guided breathing. And this is, remember, one component of meditation. There are 2 components of meditation, guided breathing and mindfulness. So let's tackle that. How does guided breathing, and what is guided breathing all about? Guided breathing is basically paced breathing, about 5 to 6 breaths per minute. Some protocols actually extend to 10 breaths per minute. In effect, it enhances the reflex sensitivity. Remember, the vagus nerve is the nerve supply of the autonomic nervous system. The autonomic nervous system responds automatically, no permission. It just increases, it responds to stimulus that you're familiar with in the past, even the smell of the trauma or anything. It reduces sympathetic outflow. That's the key when you have guided breathing. That's why you see it instantly. It improves heart rate variability. Heart rate variability is the variation of your heart rate in relation to your sinus or in your respiration. When you inhale, heart rate goes up. When you exhale, heart rate goes down. That's when the brain and the gut calms down, such that you would want to pace your breathing 4 counts. Inhale, you hold 4 counts, and then you exhale slowly with 6 counts longer and hold. So if you practice this about 15 minutes daily slow breathing, and this was reported by Anderson in 2010, the Journal of Human Hypertension, 15 minutes daily slow breathing reduced resting systolic and diastolic blood pressure. It lowered resting respiratory rate. And that makes your oxygenation more optimized. It improved autonomic regulation markers. It's a very good study. So now the question is, how do you integrate this in your prayer life? There's such thing as a breath prayer. For example, the good Anthony of the Desert, the great Anthony of the Desert in year 400 BC, practiced this breathing of inhaling, and they say, Jesus, Son of the living God. When they exhale, have mercy on us sinners. Inhale, Jesus, Son of the living God. Exhale, have mercy on us sinners. Nowadays, we can also incorporate this in our Chaplet of Divine Mercy. This is the Chaplet of Divine Mercy, where when you inhale, you would say, for the sake of the sorrowful passion, you exhale, have mercy on us and the whole world. So we repeat this. This would give you a 10 to 12 minutes of period of prayerful guided breathing, the breath prayer. Even the rosary, you can make it a meditative prayer and breathe through the beads when you're touching. Studies also have shown that even touching the beads quietly relaxes your brain and increases it. It also recruits the parasympathetic tone that will help your blood pressure go down. Is there a case for doing the guided breathing? In this patient that I have said a while ago, it improved his blood pressure and also his prayer life. He attests that he was more close to Jesus because he discovered the power of meditation in front of the Blessed Sacrament, and he meditated on his passion, the passion of Jesus for his unconditional love for us. If you like this video so far, hang on, because I'm going to tell you how to do a guided breathing. So you sit still, preferably you close your eyes, and you breathe slowly. 4 counts, inhale, hold 4, exhale 6. Follow me. Inhale, hold, exhale, hold. Inhale, 1, 2, 3, 4. Hold, 2, 3, 4. Exhale, 2, 3, 4, 5, 6. Hold, 2, 3, 4. Let's do it together. Inhale. Exhale. When you've done this 20 times, you are ready to do the second phase of meditation as suggested by the Catholic Church. At that moment, you would say, "Speak, Lord, your servant is listening. Be quiet. Keep the thoughts away. Focus on the Blessed Sacrament." At this point, you read quickly a verse about the Passion. Imagine the scene of the agony in the garden and tell yourself, "I am with Jesus alone. He is alone in solitude with his Father, and you want to be with him." You don't need to imagine the agony of Jesus or the Passion because he has done it for us. It would help. However, you can also share your own passion, your own sufferings, the joys that you want to share with a good friend. Keep it intimate with Jesus. As you breathe in, hold, you breathe out. Hold. Start with 5 minutes per day. My patients, I suggested to do it in the morning, noon, at 3 o'clock for the Divine Mercy Chaplet, and in the evening before they go to bed. Very practical. You connect the day filled with the presence of God. The presence of God keeps you tranquil through the day. If you like this video, if you like this content, please drop a comment. Ask me, suggest what other forms of meditation, Christian, Catholic meditation you have practiced. Maybe we can share it with other people. Please subscribe, share this video so that others may benefit, your friends, your relative. Thank you very much.